Hi, I'm Janet Gross. Welcome to Coping Today, a place where we take a deep dive into the complexities of mental health issues, things that affect us and society as a whole. Well, as always, Dr. Roy Salgado, professor of counseling at the University of Holy Cross, is here to help us navigate. And today we're talking about involuntary hospitalization, but some people might have heard it as another term, right?
Yeah, there are a number of different terms that get thrown out there. You know, involuntary hospitalization, a committal, psychiatric committal, PEC, physician examination certificate. There's a number of different things that, in a nutshell, convey that an individual, perhaps by a professional, a medical professional or a mental health provider, is making a decision to have someone be involuntarily hospitalized for mental health reasons because they are perceived to be a threat to self or others, an active threat to self or others. And so deciding whether or not that individual perhaps is going to have to go into inpatient treatment for a period of time on an involuntary basis.
It's a short time, right?
Yes. Typically anywhere from 23 hours to 24 hours to 48 hours to 72 hours, somewhere in that. There's a number of factors. So 72 hours is a standard to ensure that that person is getting the appropriate level of care so that they are no longer displaying symptoms or expressing in a way that is an active threat to self or others.
Okay. So if someone, I mean, this is, when you say psychiatric commitment, which I don't think is a term that's used much anymore, but because it does evoke those memories of, movies or the when they take them away and lock them up in straitjackets.
Right. It does conjure up that imagery for some people, right? When you think about, years gone by where you have what we're referred to as asylums, and people that are, they're against their wills in an asylum and they're locked up or even strapped down and in a padded room. It's not that. Today's involuntary committal is in a typical hospital with a hospital bed with physicians and nurses that are offering psychiatric care and medical care to ensure that that person's current threat level to self or others is reduced or minimized or eliminated, and to assess to see what type of further care might be required for what's presenting in the moment. So
is there a psychologist or psychiatrist or someone there who's kind of monitoring these hours that they can't leave?
Yes. So they have medical providers. There will be a psychiatrist or other mental health professionals and nurses, psychiatric nurses, that are there ensuring that they're getting their individual counseling that's happening there, groups perhaps, and perhaps medications if need be, and they determine on a case-by-case basis what perhaps might be the best course of action, and to determine if it's something that's going to be extended beyond 72 hours, perhaps even up to 15 days or so.
How, as a counselor, how do you, how beneficial is this? I mean, it's got to be the extreme of circumstance that this would happen in the first place.
Right.
And we're going to be talking about that later on in the show. But does taking somebody out of a circumstance for 72 hours or 24 hours or whatever help?
Yes, and mental health providers don't approach this lightly. It's not something that you do every day.
Yeah.
It's something that is perhaps necessary in instances. We take confidentiality and the civil liberties of individuals very seriously. You have to find that balance. We want to maintain that confidence that a person can come and trust their counselor or their therapist to be able to maintain that confidence, and whatever it is that you say will not be used against you, that you're there to help them along the way and provide counsel, to provide clinical mental health services that this person can move from the point of distress that they're currently experiencing to that of wellness. To the extent that that happens, it happens 90-something% of the time, 99% of the time, dare I say. But then there are instances where something is said and or done that the provider, the counselor, the therapist, the psychologist, the psychiatrist, or another provider must now act because they are a threat to self and others. So you have to take the confidentiality that we need to respect and the liberty of the individual that we need to respect their rights, and balance that out with the general welfare and the good of others. If they're a threat to their school, if they're a threat to their community, if they're a threat to their family, to their partner, to themselves, we need to balance that out and act accordingly.
Okay. And we're going to get back to this in a second, but before we take this first break, let's talk about the help that the University of Holy Cross and the Maronites have offered through telehealth. Explain what's that?
Yes, the University of Holy Cross has been offering free telemental health services for 4 years now, and everything that we do is free of charge, gift of the Maronites of Holy Cross. Any resident of Louisiana who is struggling with a form of distress, whatever that may be, to some diagnosable condition, anxiety, depression, trauma of some sort, you can just go ahead, call the number on the screen, and the administrative assistant will take that call and triage it to the clinical director, who will then assign a counselor in training to you, and you will receive free telemental health services. Anyone, any resident in the state of Louisiana.
Just call, because there's no, you have to be screened and all. You know, they do figure out what you can.
Right.
But you can get help without having to leave your home or that fear that sometimes accompanies. I don't know who to go to, or it's free.
Right.
Try it.
It's free. Absolutely.
Yeah. Okay, great. Well, when we come back, we're going to talk more about involuntary hospitalization or commitments with our special guest, Jefferson Parish Coroner Jerry Zatanovich. Stay with us.
Women know how to get things done. Invest in women and girls, and they will do the rest. Join us at care.org/women-know-how.
And welcome back. We're talking today about involuntary psychiatric commitments, and we welcome our special guest, Jefferson Parish Coroner Dr. Jerry Zatanovich, to the show and to our conversation. Thank you for joining us.
Thank you.
Can you tell us just a bit more about this process and how it works, how it started, what it's called, all those things?
Well, there's a process of treating somebody who's in mental health crisis is very difficult and complicated. There's lots of different abbreviations that we use, and a lot of it depends on whether somebody is willing to go to a provider or not. So if somebody's willing to go see a healthcare provider, they're taken by a family member, let's just say to the emergency room, and a provider in the emergency room would see them and make a determination that they're either dangerous to themselves, dangerous to others, or what's called gravely disabled. If the provider makes that determination, then he or she will write up what's called a PEC. Stands for Physician's Emergency Certificate, and it should be changed to Provider's Emergency Certificate. But regardless, that allows that person to be kept for up to 72 hours against their will for a psychiatric evaluation and treatment. Now, if that same person is unwilling or unable to go to see a healthcare provider, whether it be in their office or in the emergency room, then the family member or a friend would come to the coroner's office. And what they would do then is do an interview with us. They would then sign an affidavit, punishable by up to a year in jail, that what they're saying is true about the person and what is making them either dangerous to themselves, dangerous to others, or gravely disabled. At that point, the circumstances are evaluated by one of the physicians at the coroner's office, and we make a determination to issue what's called a OPC. That's an order for protective custody. Once we issue the OPC, that basically says we feel that this person needs to be brought in against their will for a psychiatric evaluation in person. That OPC is given to in our case, it's given to the Sheriff's Department. The Sheriff's Department has, Sheriff's Office has officers who are what's called CIT trained, crisis intervention training. They're very good at and properly trained in bringing people in as safely as possible, because sometimes this is a very dangerous undertaking. So they will go get that person, bring them to the hospital against their will. Once they're there, they're evaluated by a provider. The provider will then make that same determination I talked about earlier, dangerous to themselves, dangerous to others, or gravely disabled. If they agree that this person is in one of those three categories, the provider will then fill out the PEC, which is the physician's emergency certificate, and that keeps the person in the hospital for evaluation for up to 72 hours. Now, in a lot of cases, 72 hours is not long enough to treat somebody. So, those PECs are reported to our office, and we track them so that during that PEC 72 hours, we send a coroner's psychiatrist to evaluate the patient. Sometimes it's the coroner, him or herself, and sometimes it's a psychiatric nurse practitioner, but they'll go out and make an assessment on the patient as to whether 72 hours is enough. If, as is frequently the case, it's not, we will then sign what's called a CEC. That's a coroner's emergency certificate. That means that we agree with the providing physician, the attending physician, that this person needs to stay longer than 72 hours. And that gives the facility the option to keep that person for up to an additional 15 days. And that can be repeated one time for a total of 30 days. At 30 days, if you're getting close to the 30 days and that person still is in a condition where they're dangerous to themselves, dangerous to others, or gravely disabled, and either unwilling or unable to do a voluntary admission, at that point, they would have to go to a judge and get what's called a judicial commitment. So that's a long story for a very complicated process.
It really is.
It really is a very complicated process, and it starts off initially with the individual identified patient, a provider, a family member, a stakeholder within the community, perhaps an educator, a teacher, oftentimes if it's an adolescent. And so my question to you, Dr. Zvetanovich, is what would you recommend to someone like in a school system, for example? Oftentimes we, mental health providers, we get referrals from schools saying that a student can't go back into a school because of something that they said. And a lot of times a student might say something, oh, I hate you, I'm gonna kill you, or I wish you were dead, or I'm gonna just blow up the school. And they make these comments, not aware of the weight that these comments hold. And then in school systems, their protocols are that they have to now take it seriously because the statement has been made, refer them to someone like myself to assess the situation to determine whether or not they can go back into a school, for example. But my question to you is, what is your recommendation with regard to educators and teachers in terms of how to approach this, in terms of taking it to that next step? I know every school has their own protocol, but what would someone in your position say to that effect? Because it does happen often enough.
Yeah, well, in a case like that, when you have somebody who is identified as being a danger, again, that's whether to themselves or to other people, the key is to get them help as quickly as possible. And there's a lot of different ways to do that. Sometimes you just have to get the law enforcement involved immediately and get them into custody to make sure that they're being properly taken care of.
You were saying that oftentimes that it shows that after 72 hours they need more help. Oftentimes. So these are obviously have to be extreme circumstances to bring in your office or to bring in, an emergency psychiatric team or whatever to make these decisions. So they're pretty clear at that point that something needs to be done immediately, right? Is that what you're saying? It's kind of.
Yeah, absolutely. And every case is different, right? And have different senses of urgency. And, sometimes we have somebody who's very potentially dangerous, and you can do what's called a no-knock OPC, where you actually surprise that person, because of the threat assessment that's made by the law enforcement professionals. These are sometimes very easy and sometimes very dangerous for everybody involved, both the patient and the people who are tasked with bringing them in for evaluation. So these are very, very dangerous, and frequently, sadly, we get a lot of repeat OPCs. Like every couple of months, it's kind of, for a few people, it's a revolving door. And we work with the Sheriff's Department to try and address those people between the episodes. But that is a sad reality.
So you might recognize names sometimes. Oh,
correct.
It's this person again. Okay.
I would like for you to kind of differentiate between those who have psychiatric problems, who find themselves in the situation, who are being committed against their will involuntarily, and if and when something is designated as a crime as well, because we all approach this very carefully and cautiously and judiciously so as to get them care, because it is medical care that is being provided through the help of law enforcement and the judicial system, if you will, the state. Can you tell us a little bit more in terms of, does it bleed over into law enforcement with regard to crimes that perhaps are a part of this in instances?
Absolutely. There's a lot of crossover in two ways. Number one is in criminal behavior, and number two, and more so, is substance abuse. We see tons of crossover between mental health and substance abuse, whether it's somebody just recreationally using drugs or somebody trying to self-medicate, using drugs, thinking they know what's best for them. But that crossover creates a dangerous situation. Anytime there's drugs, there's crime. And so, there is, that's what creates a very dangerous situation, for everybody involved.
So if it is just if it's not that, and somebody has just, gone over the top and finds themselves in this situation, and they are, after 72 hours or however long their commitment was supposed to be, is there a record of this? Will it haunt them for the rest of their life?
No, it's their healthcare record. I mean, when there's criminal behavior, yes, of course. I mean, we keep records of who we do OPCs on. We keep all the records of our PECs. So we have internal records that we keep at the coroner's office. But as far as people's privileged health information, that's protected.
Okay, so this won't follow, their employer won't know, unless they tell their employer, but that's not going to be on their record unless it's a medical record.
And I neglected to mention early on, there's also another way that somebody can be brought in against their will. And I'm going to backtrack to our earlier conversation, and that's via what's called a 2853L. That's a Louisiana judicial code. Basically, it says that if a law enforcement officer personally witnesses, not has somebody tell them, if they personally witness a person that in their opinion is exhibiting those things, dangerous to themselves, danger to others, or gravely disabled, and they suspect mental health, they can take that person into custody and bring them to an emergency room or psychiatric facility for an evaluation.
Okay, so get them off the streets immediately and into a facility that they can...
Right, correct. And that bypasses the family having to come, or friend having to come to the coroner's office and not knowing where they are. But that only applies when the law enforcement officer is able to directly witness that type of behavior.
And clearly this is in extreme circumstances. There's a specific criteria that has to be met in order to take these next steps and these measures. So our question to you is, what is the prevalence of this in our state here in Louisiana? We have been hearing that perhaps the numbers have gone up, and it makes sense being that we do see crime is up and family structures have been compromised, and much of that has been impacted. Can you tell us a little bit in terms of what that looks like in terms of number and data here in this state?
Sure. Look, our numbers have definitely gone up. just looking at 2019, the numbers of orders for protective custody that we've done, the OPCs, in 19 we did 446. Last year we did 663, so that's a pretty big increase. The number of CECs, the coroner's commitments for 15 days, those have gone from 4,200 up to 5,200. The number of PECs, on the other hand, have remained relatively stable.
Wow, that's a lot of people. That's a lot of individuals. That's a lot of extreme circumstances.
Right, and in your experience, in terms of what is presenting itself, what is contributing to this increase?
Well, I'd say it's lack of worsening of our mental health crisis in this country.
Okay.
Lack of access, and increased substance abuse. The opiate epidemic has definitely impacted overall mental health issues in this state. It's not gotten better, and so it's a huge issue. I mean, when I compare the numbers from 10 years ago to this past year, it's even more dramatic. So we've got a expanding crisis, and hopefully the more we educate the public about what's going on to try and treat people sooner rather than later, the better. But there's some things that are out of the control of the providers, which is the substance abuse, which has a big impact on overall mental health issues.
Right. Well, thank you, Dr. Stanovich, for joining us and for giving your expertise on all this and explaining the process and the complexities of all of this, and really going through it even with all of the acronyms and all of the we don't understand, and I'm sure that maybe people who face that at one point in their life definitely don't know what's happening, but we appreciate your telling us about it. Thank you so much for joining us and for your time.
Happy to do so. Have a nice day.
Okay, you too. And we'll be back in a minute. Stay with us.
Is it okay to call you Mom?
Of course you can.
And we're back talking about involuntary commitments or hospitalizations. There's so many people involved in this, Dr. Roy. Is that, and steps to go through, is that kind of a protection in itself that this is going to be handled correctly?
Right, and it's very intentional and very purposeful in the fact that there are so many different people that have to make decisions at different levels in order for this to happen in the first place. That those different levels that he talked about, from identifying the initial distressing behavior of threat to self or others, all the way through the protective order and everything in between. And there's different players in that. And that is a mechanism to help protect the rights of the individual, balancing it out with the general welfare of others. And something that everyone takes seriously and has to take seriously, because it's not just one set of eyes looking at the situation, it's several set of eyes looking at the situation and assessing how to proceed.
Because there is a big challenge to get it right. You don't want to get this one wrong.
Right, you don't want to take someone's rights away. You don't want to have just one person, he said, she said type of situation, be it a partner, a parent, a neighbor, some random person, to that of a professional who perhaps could subjectively get something wrong. So you have to have very strict, rigid measures in place to ensure that the rights of the individual are protected and that the public general welfare is also taken into consideration when making this type of decision.
So this is a critical tool for the person involved and for the public.
It is.
Yes, and
it is, because think about the idea of a domestic violence situation, for example. If someone lodging a false complaint, the fact that there's a built-in mechanism too for someone who brings upon this charge, knowing that there is a penalty to pay if you try to do this to someone, that if you are found that this is not in fact accurate or true, that the person who attempted to do this would have consequences, legal consequences facing them to do so. So people aren't going to necessarily put themselves in that situation for the sake of getting someone committed.
Right, getting even or doing something weird like that. So that's really, and with all of the, you know, the people involved that Dr. Satanovich was talking about, I mean, it really is interviews and subject, you know, all those things together. Okay, any tips before we go?
Well, today it's more of a note than an actual tip, because, you know, there aren't any tips per se with regard to this type of situation. But we're going to go with this in terms of involuntary commitments. It's a psychiatric issue that uses a critical tool in addressing mental health crises, that a number of people come into it knowing that we need to approach it judiciously, ethically, and in a way that prioritizes the well-being and rights of the individuals involved, and weighing it in relation to the general welfare. We don't want to get this wrong. We want to get it right. We want to make sure that individuals are getting the medical care and the psychiatric care that they need, and that the public is also protected as well.
I like the show because it's not our normal thing where we try to work through, you know, a lot of people have problems and this is how you can do it. This is really just facts on how this emergency is handled.
Exactly. And this emergency, unfortunately, has gone up in our state in the past year, 20%. That's a significant number. And that's why it's important to touch on this topic, because we may find individuals who are finding themselves in this type of situation because of the level of stress and distress and substance use that is prevalent in our society. You know, everyone is experiencing an overwhelming sense of mental health issues on a variety of levels, from minimal to extreme. And you might find yourself in a situation that you didn't think yourself finding yourself in, or a loved one, and knowing that this is what would perhaps be the protocol that takes place in this type of scenario.
Well, knowledge is good, right?
Yes, it is.
There we go. All right, well, thank you, Dr. Roy Salgado, for talking things through with us. And thanks to our special guest today, Jefferson Parish Coroner, Dr. Jerry Satanovich. And of course, thanks to all your colleagues at the University of Holy Cross. And thank you for watching and being a part of Coping Today.